So, if you've ever used Viagra, Cialis, Blue Chew, or any generic equivalent, or if you've used Trimix or another form of an injectable ED drug, then you need to know about the emergency erectile disorder called priapism and how to treat it should it happen to you. Listen, a good friend of mine messaged me a little over a year ago, and he was going to an ED clinic and ended up getting home and having an erection that just wouldn't quit. 2 hours went by, 4 hours went by, 6 hours went by before he finally got seen in the emergency room. So, what that means is that because priapism is a persistent erection that can't be relieved by an orgasm, it's a kind of a persistent erection without desire or stimulation. By definition, the time is 4 hours, but it becomes an emergency well before that. So, what we're going to do is dive into how you can manage priapism kind of on your own first, that first couple hours it's going on, but then when you need to amp things up and get medical help. All right. So, the word priapism is derived from the Roman and Greek god Priapus. He was famous for his enormous and continuous erections, right? And which sounds like it would be an amazing thing, but it actually is not and can interfere with your erections long term, which is why you want to know how to deal with it should this happen. Now, it can be caused naturally, just iatrogenically, where there's a flood of neurotransmitters and it causes the veins to become occluded or blocked. Because remember, the erection happens and it stays that way because the veins kind of close off and keep the blood flow in there. So imagine a flood of neurotransmitters happens and now it's trapped. And so instead of going flaccid or soft, you get prolonged expansion of the blood vessels, which is prolonged relaxation, right, of those blood vessels that are filled with blood. So over time, what can happen after this has been 2 hours, 3 hours, 4 hours, and then into the 12 hours and the 24 hours and the 48 hours is the first 12 hours you start to get swelling and thickening in the corpora or the tissue of the erection. Then you start to get blood clots actually start to form and adhere to the blood vessel within 48 hours. And what's happening over time is that the erectile tissue stops getting oxygen because no blood is moving or flowing through. And what can happen is the tissue can actually die off or atrophy, and necrosis can step in, and necrosis is just a fancy word for the tissue dies off. So this really does become an emergency, and it happens. It can happen when you've taken your regular medications. It can happen on your recreational medicine. It can actually even happen if you've done some cocaine or ecstasy. So when this becomes an emergency, and for instance, say you're on vacation and there isn't an emergency room or you're too far from one, time is precious when it comes to priapism. So what can you keep on you or with you or head into the store, the local pharmacy, if it's in another country, or our or a drugstore here in the United States, and buy what you can as a remedy to a situation that could happen, right? So first, let's talk cause. So there is such a thing as called drug-induced priapism, which basically means that the medicine that you took could have caused it. And these medications can be the prazosin, which sometimes we use for prostate issues, hydralazine for heart failure, anticoagulants or blood thinners, which when they're stopped abruptly without weaning them off of, they can actually have blood thickening up and can actually cause priapism. Drugs taken to thin the blood, and then also antipsychotic medications and as well as antidepressants have all been implicated in causing and leading to priapism. And of course, I've mentioned cocaine and ecstasy. And a journal published by a gentleman by the last name of Tamala found that priapism in 21% of men has been caused by actually The injections, the trimix, the intracavernosum injections that some of you are taking to get an erection. Because what happens as physicians, what do? First, we try Viagra for you. Then when that doesn't work, you come back and say, doc, listen, that's not working anymore or never worked. Then we try these trimix injections, which are basically a mixture of 3 different drugs that are designed to get you erect as soon as you do the injections. And 21% of reported priapism cases are a result of that. So the Viagra's, the Cialis, the Blue Chews and things, they don't typically have priapism outcomes as much as the injectables do. Priapism can also be caused by trauma to the perineum, car accident, or injury to the groin, and it can also be caused by tumors. Another huge cause are blood disorders like sickle cell or thalassemia. So treatment of priapism is really kind of watching. Okay, you get an erection, it will not go away. All right, so the first thing that you want to do is think about, okay, can I put some ice on it? Do I have ice available? Then the next thought is, okay, pharmacological treatment. What can I take that can make this go away? And at what point do I need to head to the emergency room? So I always say, listen, 2 hours into an erection, you need to be plotting out what's next, because we can get to 4 hours. We can even get to 6 hours. But after 6 hours, the longer that erection stays there, the more likely it is that you're damaging your tissue. So you've got to start planning early for this. So and the prognosis or the outcomes of priapism, whether they have to do surgical experience on you or whether they have to give you some injection in the emergency room or what have you, the outcomes of a post-priapismal episode or after priapism really depends on how long the situation lasts. That's why I say time is of essence. So this is basically when you have a full erection, but you're not having any fresh blood flowing into the penis and no fresh blood flow flowing out of the penis. So it means nothing is getting oxygen, and that's how you get tissue damage, and that's how you can get permanent erectile dysfunction. So during an erection, just to review this, there's a relaxation of the smooth muscle and the blood vessels. So those blood vessels relax and expand, and blood flow comes into the cavernous arteries and fills up what we call the corporal cavernosum, and it becomes stiff. And so that arterial inflow is then decreased, and the blood is supposed to stay there. When the pressure in the penile tissue rises above the arterial pressure, then everything stops, and then that's how you actually keep the erection. But the problem with a priapism is that the relaxation becomes permanent. And so what we need to undo it is actually constriction. We need vasoconstriction to come in to knock that erection off so that you can actually have a relaxation and become flaccid again, because otherwise you're in for failure. So failure of flaccidness, this persistent relaxation of the tissue so that it's full, is what's causing it. And then what causes the damage is the lack of oxygen that can actually flow there. So there are 2 different types of priapism. There's low flow priapism, and then there's high flow priapism. Low flow priapism is another word for ischemic priapism, which is basically, okay, we're not getting enough blood flow to where it needs to go. And this is the result of some of the things that we just talked about with the medication, sickle cell anemia, thalassemia, leukemia. And what happens is you have an erect shaft, but the tip is soft. Right? And then you can have a little bit of pain, but the pain starts to get worse as time goes by. Then you have the other type, which is non-ischemic or high flow priapism, which basically means your erection isn't completely stiff. And it's not, your shaft isn't really completely stiff, and it's really not all that painful. So sometimes you mistake this as, just a little chubby instead of it being an emergency, and it actually is an emergency. So the aim of the treatment that they're going to do in the emergency room is first line, and that you're going to do from the local pharmacy finds, is aimed at reversing the relaxation of the blood vessels and causing them to constrict. Because if we cause the blood vessels to clamp down and constrict, there's less blood flow, and we can reverse the erection. right? So what we want is vasoconstriction. So what we're going to try first is something called pseudoephedrine. Pseudoephedrine is an alpha agonist. And it's used as a decongestant. On the counter here in the United States, it's called Sudafed. And what you would do is take 120 milligrams of Sudafed orally. And this is 2 hours in. You could try this. This is why you're looking through you're Googling, trying to figure out where you're going to go if this does not work, right? So I actually advocate that if you're on Trimix, you keep some Sudafed with you. Okay, so this is Sudafed is going to be the first line. Second line is phenylephrine. It's a sympathetic acting drug that basically does the same thing and can be used for priapism. It's an alpha adrenergic receptor agonist, and it causes that vasoconstriction that we need in order to release the blood so that you can relax things. So the phenylephrine is available in the drugstore. It's available in most drugstores locally, domestically, and abroad. The only thing about pseudoephedrine and phenylephrine is you will have to ask the pharmacist to get it from behind the counter. They don't really keep them anymore out in the aisles because people were using them to create things like meth. So those are going to be your first line. And then if you're in another country and you have access to something called terbutaline, it is basically an asthma medication, and it's over the counter in other countries. And you can try 5 to 10 milligrams, and then every 15 minutes, try that again. And then another 15 minutes, try it again. But I think the thing that you want to keep in mind here is that priapism is a medical emergency. If you see your erection lasting longer than 2 hours, and you've just left one of these ED clinics, or you've just shot up your erection with Trimix, or you've taken Viagra, or you've taken some of the medication that I've talked about, or if you have a bleeding disorder, anything like that, and it's lasting for more than 2 hours, consider this an emergency. Get your first line on there. You can actually take this on the way to the emergency room, because most emergency rooms, by the time you get there, you got to wait about an hour or two, so on and so forth. So you want to come preloaded with something that can actually be helping you while you're waiting for God only knows how long to get seen, right? And then the other one that you can actually do is phenylephrine. If you have either one of those available, that's going to be your first line. But head to the emergency room if it's lasting past that 2-hour mark, because once you get to the 6-hour mark, that's when we start to see damage kick in that takes a bit to reverse it. And if it lasts for more than 24 hours into 48 hours, you actually start to get necrosis or tissue dies, and bam, you have ED forever. So when you're using your erection medications, these are some things that you've got to keep in mind. This is why I teach you natural ways that you can stiffen up, because there's always room for improvement, and you don't have to rely on prescription drugs for everything. All right. So like this video, share this video, and subscribe so that you know the next time we post. See you later.